Hey everyone, welcome to the Age Like a Boss podcast. I'm your host, Jennifer Singh. So this is a question I get all the time. What is lifestyle medicine? What in the world is a lifestyle medicine doctor? A lifestyle medicine doctor is a physician who already got trained in another specialty, and it could be any specialty. I was trained in internal medicine and pediatrics. But later in my career, I went through what I like to call, kind of jokingly, for many of us in medicine, the first dark night of the soul of my career. This is the point that so many doctors come to where they realize that we don't really have great tools in the existing medical system for actually reversing some of the diseases that are causing my patients the most grief, like diabetes and heart disease, and even cognitive diseases like Alzheimer's. Lifestyle medicine was the first time I had encountered other doctors who were having a completely different approach. They were talking about reversal. They were talking about helping people not just control their diseases, but treat and reverse their diseases really in their own kitchen and in their own daily lives. I was hooked. I knew that this was something I had to be a part of. And I got further education, and it changed my personal health and the trajectory of my whole career. Before I learned more about lifestyle medicine, I think that my previous kind of misconceptions probably represented a lot of people's thoughts. I really thought that anything like lifestyle medicine or integrative medicine was way too alternative, way out on the fringe, and probably did not have enough meaty science behind it that I would actually think it was valuable enough to put into everyday practice. The other misconception that I had prior to really becoming educated was this myth that so many of us in medicine tell ourselves, which is they won't do it anyway. We really feel so overwhelmed by trying to help people change their daily behaviors that even if we did believe that nutrition helped, we really just didn't feel adequately trained or resourced to really actually help people change their everyday habits. Thankfully, learning more about lifestyle medicine corrected all of that for me. Let me walk you through a little before and after what a doctor visit or a clinic visit with me might have looked like before lifestyle medicine and what a clinic visit with me might look like after lifestyle medicine or with another lifestyle medicine doctor. Before lifestyle medicine, if you came to me and we diagnosed you with high blood pressure and diabetes and maybe overweight, I would have begun immediately to write prescriptions because that was the best training that I had at the time. Prescriptions were my love language for patients. The more prescriptions I wrote, the more referrals I made, the harder I was trying and the more effectiveness I was trying to get for you in these conditions. After lifestyle medicine, I would still write prescriptions. However, I would spend an equal amount of time stressing to you the importance of your power to control these chronic conditions. And I would inject you with so much hope that these did not have to be lifelong conditions for you, that together we could work together to get you the resources that you would need to make meaningful changes in your diet, make meaningful changes in your fitness level and your stress reduction, to control these conditions either without medications or on limited medications. Now, lifestyle medicine is not a complete departure from westernized medicine or even the use of prescriptions and procedures. Those are powerful, amazing tools that have completely changed the face of medicine in the past 50 to 100 years. However, incorporating the incredible power and just learning about the science and the evidence for the power of nutrition, movement, stress management, and sleep is not a separate science. It is a science that is married and should be married with what we have learned about prescriptions, procedures, and all of what we consider to be modern medicine. These two should work powerfully together. I know that when I'm actually prescribing someone maybe a low introductory dosage of blood pressure medication, that giving them an equal amount of emphasis on the importance of a 20-minute walk every day and very practical, easy tips to help them lower the sodium in their diet is going to have an equal effect. By the way, that's true. Did you know that a walk every day has an equal outcome effect on blood pressure as a low dose diuretic daily for mild hypertension? It's true. So, lifestyle medicine in a clinic visit would give you both of those, not telling you to completely ignore what we know about modern medicine and the benefits of some medications, but marrying it with an incredible dosage of empowerment for yourself to own and control what you can do to reverse chronic disease in your own life and improve your quality of life. Here's another funny story I like to tell. No one ever comes back to their doctor and says, "That cholesterol medicine you put me on, thank you so much. It made me feel incredible. I have so much energy and I've lost weight and my sex life is great." Said no one ever about a cholesterol medication. However, some walking, some weight loss, some change in diet, some improved sleep, I have had patients come back to me and say those things when lifestyle medicine was married with modern medicine. Not everyone has access to a lifestyle medicine doctor. You may be thinking to yourself, my doctor has never given me advice really useful about diet or fitness or whatever. I totally get it. And I want to encourage you that it's not completely necessary. I don't even go to a lifestyle medicine doctor. My internist is wonderful, but she has not gotten lifestyle medicine training. If you want to know how you can begin to apply lifestyle medicine in your own life, that's exactly what I'm going to be covering here. In my next several videos, I'll continue to tell you how you can look for a lifestyle medicine doctor in your area, but also how you don't have to have a lifestyle medicine doctor to get started implementing powerful changes to control and possibly even reverse chronic disease in your own life. So before you go, please don't put this off. This is not an oil change. Stop, subscribe, like, drop a comment. And if you have any questions, I would love to answer them for you. Drop them in the comments below.